My presentation focused on the policy Allied Health Workforce Diversity Act of 2021. I'm Marcel Walker, as everyone knows. So let me share my screen. So the Allied Health Workforce Diversity Act of 2021 is also known as S.1679. It is also proposed to the Public Service Act, which is run by the Senate Health, Education, and Labor Committee. It is known as the federal level of law. What is the difference between federal and the local law? The federal is created by the federal government, and the local law, are laws that are passed through individual states. In this particular act, the sponsors that created this act are Robert Casey Jr., Tina Smith, and Lisa Markowski. For Robert Casey Jr., he's a Democrat in the United States, and he has been in the political since 2006. In 2007, he represented Pennsylvania, and he was also state treasurer before running for Senate. He was the first Democrat to win for the third consecutive time. Tina Smith took office in 2015. She led the Destination Medical Center, and she was previously a governor in the years 2015 to 2018. She's also part of the Democratic Party. And Lisa Markowski is part of the Republican Party, was previously a House Representative in Alaska, and she assumed office in this year of February 3rd, 2021. So what are the guidelines of this policy? The guidelines are the policy is authorizing assistance for increasing diversity in the workforce for therapists such as occupational, physical, respiratory, audiology, and speech language pathologists. This policy is to improve education and financial opportunities. So as a minority, I find it frequent that most individuals either want to be interested in these professions or they don't have the money, so it's harder for them to even get into the field, or they feel as though they don't see people that look like them, so they don't even bother putting in the effort to even go through the education because maybe it's hard to find a mentorship or get the help that they need or the courage, things of that nature. So I listed out the definitions of the differences of an occupational therapist, physical therapist, respiratory therapist, and audiology and speech language therapist. So the occupational therapists help people across the lifespan that participate in everyday therapeutic activities such as bathing, toileting, feeding, or as simple as medication management. The physical therapist focuses on movement. They're movement experts through prescribed exercise, hands-on care, and patient education. The respiratory therapist, as we know, is currently booming due to COVID-19. They specialize in chronic respiratory diseases. The audiology and the speech therapist, they focus on communication in regards to hearing along with understanding the language. So what is the history of the policy? The policy was introduced in 2021, and it was related to the previous bill, HR 3637, which was a bill in the year of 2019, which was called the Allied Workforce. It is very similar to the bill that was introduced this year because unfortunately it was not passed. And it is known as being a companion bill due to it specifically being related to the bill that is being processed at this moment. So in relation to this bill, how I initially found this bill is I went on AOTA, which is known as the American Occupational Therapy Association. So it's a national occupational therapy website. And basically, if you go through occupational therapy school, your first year, that is the first thing that your professors will introduce you to. It includes, you can be a student, and it also can be used for clinicians to let you know what's happening this year and past years, the current events. You can subscribe to magazines per month of how you can go about your interventions with your patients or clients. And then, of course, the most important evidence-based practice, which are journal articles or studies that have shown proof that this is something that is proven to work during your interventions or even research. As far as the progress of the bill, doing research, I feel like there were a lot of roadblocks. There currently isn't any progress with the bill. It's been at a standstill since February 2021. I did speak to one of the representatives in my state, and they didn't even really know about the bill. And they did say that it goes through like different queues and importance. So I feel like this bill isn't seen as important as other bills. I'm not sure if it's because of the pandemic we're in, or they just don't feel as though like therapists in the health profession is that important, but I really feel like it's on a low priority. I feel like there's not enough support and advocacy. As I said before, not a lot of people know about it. Obviously, the profession of us all occupational therapists like banding together can possibly bring knowledge to it, but I feel like it's just not enough. I feel like we need more politicians involved and things of that nature. I feel like it's not, like I said, a priority, and the information listed is very limited. I do not see it on social media. I do not see it. It's kind of word through mouth, or if you have an assignment like this, like something you would really have to research. So in general, the role of occupational therapy, I feel like is very important because it can be addressed in many different settings, such as mental health, geriatric, school setting, home setting. The roles are increasing rapidly. Um, so the job scope was in the years 2020, 2030, there would be over 131,600 job perspectives. And then they did say the percentage would increase from 17%. It the average is 8%, but it will increase to 17%, which basically says that they expect the job roles to increase rapidly, which means they need more people in the profession, which means it would make sense for them to get to funding for people of minorities to, become these therapists or, get into the role, because it's important. If there are patients, the geriatric population is increasing. That's an example. So I feel like we need more therapists to take care of, the geriatric population or even the pediatric population. There are different state associations. Um, in my state, there's one in New Jersey, and I'm a part of, and they do have meetings you can attend, or even speaking to like different representatives to get more information. So I think through networking, that would be very important. And that's the end of my presentation.